Hi, I'm Dr. Boss. I'm the owner of Best Friends Veterinary Center. Many veterinary hospitals cater to dogs more so than cats. A lot of veterinarians are not real fond of working with cats. Almost all of our employees own cats themselves. I really enjoy working with cats. So a lot of what we do in our practice is geared to make visits with cats more pleasant for both the cats and for the owners. Many owners don't bring their cats to the veterinarian, not only because they don't perceive that cats need veterinary care, which is a whole nother story, but because bringing them in is so stressful. About 50% of clients report that even thinking about putting their cat in a carrier and bringing it to the hospital is a stressful situation. So we want to help our clients to be able to bring their pets in the hospital without so much stress and worry, and we're going to tell you some ways that we go about doing that.
Here are some tips to make veterinary visits less stressful for your pet. Think ahead. Get your pet accustomed to as much of the process as you can long before the day of your visit. Cat carriers should be used as a resting and/or feeding place routinely, so being in it is not as stressful. Take your pet for car rides around the block or to a fun place so riding in the vehicle is not a big deal. Visit us weekly so we can love on your pets and give them treats. Use pheromone sprays, wipes, or collars on the pet or in their carriers. The scents of these products are soothing and calming to pets. We have free Feel-Away wipes to use in cat carriers in our office. We also have Feel-Away diffusers in the exam rooms that we use most often for cats. Play soothing music in the car. There are CDs of music made especially for pets that work well. Limit food before the appointment so treats are more effective. Hungry pets respond better to food rewards. Having an empty stomach also reduces risk for vomiting in the car, and less fat in the blood makes the blood test results more accurate if we do need to do any testing on your pet. Let us know if your pet gets anxious for veterinary visits so that we can make them go more smoothly. For example, as soon as you arrive, we can move you into a quiet exam room where there is less noise and distraction. Do not put cat carriers on the floor if you have the opportunity to put them higher up so that the cat inside doesn't feel as vulnerable. Do not let dogs get close to the carrier. Cats get very stressed when forced to be eye-to-eye with a strange dog. Dog owners, this is something you can help cat owners with. Tell us if your pet does better with a certain type of handling. Is he or she more calm on the floor than on the table, away from you or with you? Are there certain treats he likes better? We would like to do more of what relaxes your pet and less of what makes him more agitated or nervous. Utilize natural anti-anxiety remedies. There are quite a few, including melatonin, valerian, Rescue Remedy, and Calms Forte. Don't be afraid to try prescription anti-anxiety medications. Veterinary visits can be very traumatizing. A dose of Xanax can make a huge difference, and anti-anxiety medications are very safe. The danger to your pet's psyche from a terrifying visit far outweighs any medication risk. Exude calm and quiet during your visit. Pets take their cues from their owners. The more relaxed you are, the more relaxed your pet will be.
Hi, my name is Dr. Paige Wilder. Best Friends Veterinary Center is accredited by the American Association of Feline Practitioners as a cat-friendly practice. This means that we understand and value the distinct needs of cats both in our physical environment and the way that we deliver medical care. Here are 10 things we do to make your pet's visit less stressful. We don't always perform our exams on a cold exam table. Using a warm, fuzzy mat on the table, leaving your cat in the bottom half of its carrier, or getting blood pressure readings while your pet is in your lap are all things we do routinely to reduce fear. We use a lot of bribery. If we can get a pet to associate us with tasty treats, we can turn visits from negative to positive, especially first visits to our hospital. Liver treats, baby food, and nuggets of dry food can all be used to win pets over. If your pet has a favorite snack, bring some along. Gentle handling is always our goal. If your pet becomes more frightened in a certain position, or with our regular method of restraint, we will try something else. If a pet starts to struggle, we back off and figure out a different way. Petting, stroking, and ear rubs help release calming endorphins. Low voices and slow movements also help. We reduce pain whenever possible. We put a new sharp needle on the syringe after we've poked through vials, so we aren't poking with a dull needle. Sometimes we use a smaller needle for tiny pets. We use topical anesthesia before microchipping and sedate pets before inserting IV catheters. The less pain your pet feels, the less traumatic visits here will be in the future. Cats feel less stress if they feel they are hiding, so we often cover their heads so they can't see us. We bundle pets up in towels, hang covers over cage fronts and carriers, and try not to let cats see strange dogs as we carry them around the hospital. All of our team members have been trained in low-stress handling techniques. This is part of the certification process we have done through the American Association of Feline Practitioners. We also utilize techniques from Dr. Sophia Zien, low-stress handling, restraint, and behavior modification for cats and dogs. Dr. Yen's DVD on counter conditioning techniques is one of the most commonly loaned out items in our library. We also utilize toys during puppy and kitten visits. If we can get a pet to play, it's probably not frightened, and it will associate visits to the hospital with treats and toys. When it's obvious a pet is going to freak out, we stop. If it's not urgent that we complete a treatment, we can always come back to it later. We would much rather have your pet come back a different day with some anti-anxiety medication on board or administer a sedative than force the pet to submit and have her be terrified. For anesthetic procedures, we can administer anesthesia without removing a cat from the carrier, and we can wake them up in their carrier after surgery as well. Your cat won't even have a memory of being handled or injected. We make house calls. If we can reduce stress by paying your cat a visit at home, we are happy to do so. We help you with all of the 10 things we recommend that you do to help alleviate stress. We provide feel-away products, books and DVDs on behavior and training. We also have thunder shirts to use as needed, and we play music in the kennel areas. What stresses you or your pet stresses us out as well.